Hi there, it's Justin Lubino with Senior Advisors. I wanted to create just a short video here about a lot of common question that we get, especially during this time of year as we approach the annual enrollment period, which is October 15th to December 7th. We get a lot of questions about these commercials that people see related to Medicare, and they're offering these additional benefits like dental cleanings or vision exams. Some plans are offering now meal reimbursements after a hospitalization. And we get a lot of questions about these plans and what they really are. And I just wanted to highlight so you understand the high level differences between original Medicare with a Medicare supplement and a Medicare Advantage plan, also called Part C of Medicare. Most of those commercials you're seeing are for those Medicare Advantage plans. So I want you to understand what they are versus a Medicare supplement. And just so you know, we offer both of these paths. We can help people with either one of these paths if you choose to go in either one of these directions. Now, the left side is original Medicare. So that's one option you have when you go on Medicare. You can keep, that's the red, white, and blue Medicare card you get from the government, and you'll still have your services provided by the government, administered by the government, your Part A hospital, Part B doctors, your prescription coverage, Part D. You can enroll in a separate plan there. And then also a Medicare supplement, also called Medigap plan, to fill that gap of 20% that Part A and B of Medicare don't cover. All right, so that's one path you can take. The other option is the fully privatized option, which is the Medicare Advantage plan, where the insurance company basically takes over and fully manages your benefits for you. And they bundle all of these benefits together into one plan. The Part A, hospital, B, doctors, and then the D, drug plan, bundled all together into one plan and administered by the insurance company. All right. You can't do both of these options at the same time. You can only be in one path at any given time, either original Medicare or a Medicare Advantage plan. All right. So what are those differences? High level, with original Medicare and a supplement, it just supplements Medicare. So you still have that red, white, and blue Medicare card, and your supplement just supplements. It pays the other 20%, or for example, that Medicare isn't covering with the supplement. With Medicare Advantage, it replaces your Part A and B of Medicare. So you're no longer on that red, white, and blue Medicare. Now you're with, for example, United Healthcare, Aetna, or Cigna, WellCare, whatever insurance company you sign up for with that Medicare Advantage plan. They're fully administering your coverage. You're no longer on Medicare when you sign up for that Advantage plan. Now, you still have to pay the government for those Part B premiums and any IRMAs, income-related monthly adjustment amounts for the Part B or Part D that you have. But your coverage is now administered by the insurance company if you sign up for that Advantage plan. Private network. With original Medicare, there's no private network. You go to any doctor or hospital in the country that accepts Medicare, which is almost every hospital in the country, and about 90% of providers accept original Medicare. With the Medicare Advantage plan, most of these are HMO type plans, so you have to go to a private network of doctors and have network option. However, even in those plans, the provider still has to accept the payment terms, or you can't see that provider if they're out of network. Referrals. There's no referrals required with original Medicare. So you can go to a specialist, just call them up and make an appointment. With Medicare Advantage, some of these plans still require referrals. So you would have to go through your primary doctor first, get the referral, and then be able to see that specialist. Part D drug plan is not included with a Medicare supplement. So you'd have to go get a separate standalone Part D drug plan for your prescription coverage if you went with this path. With Medicare Advantage, that prescription plan is bundled in with the Advantage coverage. All right. Monthly premiums, that's the amount you pay monthly to the insurance company for the insurance. With the Medicare supplement, they're going to vary just like with the Medicare Advantage, but they're generally higher than they would be with a Medicare Advantage plan. So you're going to pay a higher monthly premium with a supplement, most likely, than you will with an Advantage plan. All right. There's some Advantage plans that have a $0 per month premium. All right. However, the out-of-pocket costs, so things like copays, deductibles, coinsurance, with the Medicare supplement, and it depends on which one you get, but for most of the Medicare supplements out there, there's zero to very little out-of-pocket cost, maybe a couple $100s a year in out-of-pocket cost. With the Medicare Advantage plans, in 2021, the maximum out-of-pocket is $7,550. So if you do get sick, Hospitalization generally is a few $100s a day. It depends on the plan. Copays for your doctor, specialist tests. Expensive things like chemotherapy, kidney dialysis, infusion therapies, and other Part B medications, you'll pay 20% the cost up to that $75.50 for the year, and that's per person. So there's more exposure there with those Advantage plans versus the Medicare supplements. Again, you're paying a lower premium most likely, but there's more exposure if you get sick. And then guaranteed renewable for life. With a Medicare supplement, as long as you pay the premiums, the coverage is federally regulated and it's guaranteed renewable for life. So the coverage will never change with the Medicare supplement. With the Advantage plans, they change every year. Around September, you get a book called an ANOC, or Annual Notice of Change, if you're enrolled in an Advantage plan, which explains all the changes to your plan. Also, the plans could go away. The carrier could cancel the plans, and you'd have to find a new Advantage plan if they do cancel the Medicare Advantage plan. And lastly, just so you understand, when you first go on Medicare, Part B of Medicare, when you first enroll in Part B of Medicare, you get a 6-month, it's called Medigap Open Enrollment Period, or Medicare Supplement Open Enrollment Period. During that first 6 months of Medicare Part B, there's no medical underwriting to get a Medicare supplement, meaning anyone who applies during that 6 months can get a Medicare supplement with no medical questions, guaranteed to be issued by the insurance company. All right. After that 6-month period, to get a Medicare supplement or to switch a Medicare supplement, you have to go through what's called medical underwriting, where each carrier has about 10 to 12 different knockout questions. If any one of those questions is a yes, you can't even submit an application for that Medicare supplement once you're past that first 6 months. So it really is kind of a lifetime decision when you first go on Medicare, making sure you choose the right coverage for your specific needs, because there's a possibility you may not be able to get into a Medicare supplement in the future, just depending upon your health condition. So, and last point on that, there's certain states where those underwriting rules are different. For example, New York and Connecticut, there's no medical underwriting for the Medicare supplement, so you can get into a Medicare supplement without any medical questions. At least as of today, there's no medical underwriting. We don't know if that's going to change in the future. So anyway, I hope you found this video helpful in understanding those high-level differences between Medicare supplements and Medicare Advantage plans. I do expect you've probably seen a number of commercials. Most of them are related to those Medicare Advantage plans, and just want to make sure you understand those high-level differences between the two options. I hope you have a great day. Thank you.